Sedation Part 2. Ketamine, Ketalar. Class, non-barbiturate anesthetic. Action, rapid-acting general anesthetic and a NMDA receptor antagonist, a derivative of phencyclidine, PCP. Indications: sedation for intubation, pain, sedation, and sometimes used as an adjunct to nitrous oxide. Contraindications: stroke, severe hypertension, cardiac instability. Caution with schizophrenia. Onset duration. Onset 30 seconds. Duration 5 to 10 minutes up to 1 to 2 hours. Dose and route: adult sedation 1 to 2 milligrams per kilogram, IV over 1 minute, or 4 milligrams per kilogram IM. Pain 0.3 milligrams per kilogram IV, IO, IM, IN. Peds sedation greater than 2 years 1 to 2 milligrams per kilogram IV over 1 minute. Pain 0.3 milligrams per kilogram IV, IO, IM, IN. Etomidate, amidate. Class, anesthetic, non-barbiturate hypnotic. Action. Etomidate is a very potent drug that acts on the reticular activating system to produce a short-acting anesthesia with amnesic properties. Etomidate has very little effect on respiratory drive, which makes it ideal for certain procedures. Indications: pre-medication for intubation, synchronized cardioversion, conscious sedation for bone dislocation relocation. Contraindications: labor and delivery. Onset duration: onset less than a minute, duration 5 to 10 minutes. Dose and route: adult 0.3 milligrams per kilogram IV over 30 to 60 seconds, limited to 1 dose. Peds greater than 10 years old 0.3 milligrams per kilogram IV over Peds greater than 10 years 0.3 milligrams per kilogram IV over 30 to 60 seconds with a max dose of 20 milligrams. Rocuronium, Zamiron. Class, non-depolarizing neuromuscular blocker. Action, competitively blocks acetylcholine at the neuromuscular junction, causing chemical paralysis. Indications: paralysis for advanced airway placement and mechanically ventilated patients, commonly used in RSI. Contraindications: anticipated difficult/failed airway, chronic neuromuscular conditions, myasthenia gravis. Onset duration: onset 1 minute, duration 26 to 40 minutes. Dose and route: adult and peds 1 milligram per kilogram IV with 0.5 milligrams per kilogram for subsequent doses. Succinylcholine, anectine. Class, depolarizing neuromuscular blocker. Action. Succinylcholine is a short-acting, depolarizing neuromuscular blocking agent that binds to postsynaptic cholinergic receptors found on motor end plates, thereby inducing first transient fasciculations followed by skeletal muscle paralysis. Indications: to facilitate endotracheal intubation, terminate laryngeal spasm, muscle relaxation. Drug of choice for initial paralysis in RSI. Contraindications: burns or crush injuries greater than 72 hours, skeletal muscle myopathies, inability to control airway or support ventilations with O2 and positive pressure BVM. History of hyperthermia, rhabdomyolysis. Use caution for patients with hyperkalemia, renal failure, trauma/burns, electrolyte disturbances, and crush injuries. Onset duration. Onset less than a minute. Duration 5 to 10 minutes. Dose and route. Adult/peds 1 to 1.5 milligrams per kilogram IV IO for RSI. Infants 2 milligrams per kilogram IV IO for RSI. Nitrous oxide, Nitronox. Class: gaseous analgesic, anesthetic. Action: nitrous oxide is a blended mixture of 50% nitrous oxide and 50% O2. When inhaled, it depresses the CNS, causing analgesia. Due to being administered with high oxygen concentrations, it also increases oxygen tension in the blood, thereby reducing hypoxia. Indications: traumatic musculoskeletal injury, burns, moderate to severe pain. Contraindications: ALOC, hypotension, chest trauma, pneumothorax, COPD, abdominal pain or injury, head injury, bowel obstruction. Onset duration. Onset 2 to 5 minutes. Duration 2 to 5 minutes. Dose and route. Adult and peds. Self-administered by patient via held mask or mouthpiece until effects are felt.